Hi, my name is Christoph Sommer. I'm a heilpraktiker working in Munich, Germany. I met Jean-Pierre Barral, the developer of visceral manipulation and more modalities in the field of osteopathy 28 years ago, and I'm teaching in the Barral Institute and his method for 18 years now. The neural curriculum was developed by Jean-Pierre Barral after the visceral curriculum. He actually came to it because in his practice he was meeting a lot of traumatic injuries that he wasn't able to resolve before. So by exploring the meninges and the impact on the body through trauma onto the nervous system, the nerves themselves and the brain itself, he was able to resolve a lot of residue issues after whiplash accidents. So treating with this technology, I would say, is how you get clients to stay well and lastingly well after your treatments, which you weren't able to do before. The neural manipulation upper extremity class is focusing on the peripheral nervous system of the upper extremity, reaching elbows, hands, and the shoulder, of course. Again, many injuries appear and influence the nerves that then are not resolved after normal treatment, and you learn in this class to very specifically feel how a nerve and how the elasticity of the nerve and how the nerve in its context is free to move. If you're moving your arm like that, a nerve needs to elongate or be able to elongate for 4 centimeters, which is about 2 inches. So in this class you very specifically learn to treat the nerves, the anatomy, the physiology of the nerves, but you also learn to focus on specific shoulder problems that are not resolved, or elbows, or hand and carpal tunnel syndromes.